Hello everyone. Today in Heal Your Heart Vasomeritech EECP Treatment Center, we are going to discuss about sudden cardiac death. As the name indicates, sudden cardiac death means death occurring within second because of heart disease. So what is the reason for sudden cardiac death? There are multiple reasons, but what important the patient should understand is the reason for sudden cardiac death is different for different age group. So it's a completely different etiology if you are elderly, and it is very different if you are a younger age group. So in an elderly age group, the sudden cardiac death, the most common cause is heart attack. So we have many risk factors. So when the risk factor is already there and the patient has some symptoms, so we know these patients are cardiac patients and they do get a sudden cardiac death. It's most probably because of a heart attack. So usually what happens in them is the blood vessel which is carrying blood to the heart muscle is get obstructed. So when the obstruction suddenly got ruptured, the clot forms in the obstruction, completely occlude the vessel and causes a massive heart attack. So in this incident, people will have previous symptoms. They may have a chest pain, they have ECG changes, they are already under medication, they are diabetic, they are hypertension. So there are a lot of risk factors already there, and then they get a heart attack and they die suddenly. But the same is not applicable for a younger age group. So in a younger age group, less than 35%, sudden cardiac death do occur. But the reason usually is not a myocardial infarction or a heart attack, it is completely a different one. So what it is, the main cause for sudden cardiac death in a younger age group is called electrical impulse failure, or we can say a manufacturing defect. So they are born with this problem. So they have a congenital abnormality which reduces the blood supply to the heart muscle, or inherently they have a heart muscle, it is very thick, or very importantly, any stress, for example, a happy moment or a stressful condition like people are dancing or in a gym, any stress may precipitate something called irregular heartbeat or irregular heart rhythm. So your heart has a rhythm which is very regular, which is very rhythmic or systematic. So it goes every beat, it has a particular interval. Suddenly when these patients with the sudden cardiac death, the interval is not maintained and the heart become irregular, or the heart instead of rhythmically contracting, it start quivering. In this condition, when the circuit failure or the electrical failure happens, immediately the heart stops, shut down, and the patient can die within couple of seconds. So this is a reason for sudden cardiac death in younger age group. That is why we don't find much of a symptom in younger age group, where we found lot of symptom in aged group. So if you want to screen for this sudden cardiac death in younger age group, it is important they do some basic investigation to find out if they do have a congenital heart problem, like a ECG and a echo. These simple things can able to identify some of the complication which may later lead to a sudden cardiac death.